There's always a risk when you talk about technology that the tech doesn't work. So at the risk of incurring this risk, let's get going. First of all, Zev, it's an absolute pleasure to be here. And when I was getting up at 5 a.m. this morning to come to Berlin, I guess what gave me the energy was the fact that this is a topic that actually gets me out of bed in the morning. So I'm hoping that you will get as energized as I am about this. I think for the video, in case you didn't capture my introduction, my name is Jaime Cattell. I'm a partner from McKinsey, so hopefully that's recorded for posterity. One of the many privileges of working at McKinsey is just the fact that you get to work at multiple angles of any issue. Now, healthcare and technology is a very fast-moving area, and I've seen it from the lens of the payers, from the lens of the healthcare system, from the lens of venture capitalists, pharmaceutical manufacturers, device manufacturers, high-tech companies, telecom companies, consumer goods companies, et cetera, et cetera. So the brief I've had from Zev is to try and give you an overview, a frame for thinking about how this opportunity is actually evolving, and that's what I will try to do in the next 30 minutes. So hopefully this tech works. Let me just see. So it's always, I think, good to start in life by settling on what we're actually talking about here when we say technology in health. I find it's one of those areas where if you ask 5 people, you probably get at least 10 answers. Right? So I'd like to at least propose a very simple definition, which is to say it's really about innovating the healthcare delivery model using information technology. Which is a bunch of information, also communication technologies. But its real objective is about making a difference in terms of outcomes. So we're talking about patient experience, we're talking about costs, for example. Right? Now this is being underpinned by three technologies that I think are significant. One is new channels, which are really just new ways to interact between physicians and between patients and physicians. The second is new data. Data is underpinning many of the interactions. Data is creating a huge world of transparency and huge opportunities to find new insights around how to improve outcomes. And finally, devices. I think you spoke about the Moore's law, the plummeting of devices. You know, we're seeing things like implantable biosensors, for example, which were 3 years ago so expensive to never be any kind of viable business, today actually becoming a viable business because that relentless cost curve is bringing them within the reach of many. Now, I haven't here talked about the demand factors. These are all supply factors I've been talking about. Now, what's equally important is that the whole demand side of healthcare is now ready for this. I think, again, if you look at other industries, the whole expectations of how you interact with technology have been completely reset by your day-to-day interaction with various companies. There's more internet savviness around. Secondly, if you look at the healthcare system, you know, parts of it are bankrupt. There's a huge cost pressure. So this technology could actually be, you know, one of the strong saviors around helping to deal with that. If you look at aging, chronic diseases, etc., there's lots of new demands that are going to hit the healthcare system, and we think that tech could actually play a role in meeting that as well. So it's getting hot. I think, as you said, we've taken a long time to get to this, but hot again. Right? What does that mean? That means that we've seen false dawns before. We've seen lots of promises. You know, we've been having different conversations about this for the last 5 or 10 years. Lots of money's gone into it, but been wasted. Lots of careers have actually been burnt on it. So it's definitely an area where it should come with a health warning attached to it. Although I think we are seeing a perfect storm now of the supply factors and the whole demand factors coming together, which means that it will actually take off and happen now. Almost on a daily basis, there is technology health-related news. A new impactful analysis on a healthcare data set, for example. A new joint venture between a medical technology company and a high-tech company. Or a new policy announcement from a government on how to promote telecare, for example. This is what's happening in the broader world. If I look at my personal life, within McKinsey last year, 10 of my colleagues left to either join or start a new high-tech venture. Just last week, 3 private equity companies called me about a company I was looking at for another one to say, can you help us acquire this? Obviously, I had to say, no, I can't even talk to you, but you can talk to my colleagues. But that just shows some of the sort of hotness around the space that's actually happening at the moment. So with this as a backdrop, with these trends that we see, I really see there are four critical questions that I'm certainly seeing, and I would like to frame these for you today and talk about, hopefully, some of the emerging sets of answers and still some of the remaining areas of uncertainty. So I guess the first thing really is, how impactful will this really be on the delivery of health? How much impact will we have for the patients and for the system? Second thing is, what are the major trends that we're seeing that you really want to watch out for? And I'm going to talk today about 5 that I think are absolutely critical to how this space evolves. The third point is really, will this be more of an evolution where pretty much the healthcare system stays as it is? Or will it be disruptive? We've seen disruptions in other industries. You mentioned Apple. Apple has been hugely disruptive, right? So will we see an Apple equivalent in healthcare that will really start to scramble things up or not? And then finally, what are some of the barriers and challenges, but more importantly, what will it take to win in this space? So let's move on to the first one, the impact. Really here the question is, does technology have the potential to address what I would call some of the key structural issues with healthcare? Now, here's a somewhat stylized, illustrative, and hypothetical example of a typical diabetes patient in a European country. You'll probably see the doctor in 1 year for an hour, face to face. You'll probably have around 3 hours seeing the nurse, and you'll spend 8,756 hours managing your own condition, right? But if you were to allocate the resources across those 3 buckets, you'll find that 97% of the money that's spent on healthcare is devoted to the 1% of time that the patient is actually face-to-face with the clinician. So it's almost as if the healthcare system defines value added as time you have a face-to-face interaction with the clinician. Now, if you think about driving even a very small improvement in that 99% of the time that the patient manages their own condition, you could have a humongous impact compared to even driving a very large improvement in the way that you actually conventionally deliver healthcare. Now, this is obviously somewhat of a stylized example, but I think this is sort of the underlying concept for how this could actually enable a transformation in healthcare delivery. And now let's try and lay out a bit some of the drivers that could actually potentially make that happen. So how would we transform healthcare delivery? I think the first thing is, this has the potential to really extend the reach of the doctor with lower cost virtual channels, and also, for example, gives you the ability to diagnose remotely, for example, using a network of sensors. It also creates additional touch points outside of the point of care, including SMS reminders, remote monitoring, and coaching interventions on lifestyle. And let's face it, for many of the lifestyle type of chronic diseases, it really is that change in lifestyle and the interventions that you can do using technology that change habits. That's probably the more important thing in terms of getting many of the big healthcare costs under control. And finally, it just provides patients with a much broader, global, deeper expertise, which they would otherwise not have. So much for the theory behind this. What does the practice actually look like? Do we actually see some of this potential unfolding in reality? Here, I'd sort of say yes, but sort of yes and no. Yes, we do see numerous examples of real impact happening. Let's say emissions decline by 20%, 88% decline in costs, 50% decline in mortality. These are, random controlled trial validated results in a real healthcare system. So we certainly see some impact. The question is, or the real challenge is, that it's difficult to scale the impact up. And I'll highlight some of the reasons later on when we get to some of the barriers. But I think that really is the sort of question: how do you start to move to scale some of the impact from these new techniques and technologies? Let's now move on to the second question. What are some of the major big trends? For me, there are sort of 5 big ones that I really care about. I think the one is, we're seeing the whole delivery of care being transformed through technology, shifting to low cost and more standardized models. Second one is this new data creating much more transparency around outcomes, having very profound implications on R&D, marketing, and also care delivery. The third is moving away from products being kind of thrown across the wall by the manufacturers into the healthcare system to actually creating services and solutions around them, and technologies at the heart of actually creating that wraparound there. The fourth is the source of information shifting away, and the ownership of that shifting away from pharma providers more into payers and consumers. So almost the kind of information asymmetry that exists within healthcare is actually moving. And the final one is the fact that all these new partners are coming into the healthcare ecosystem, and to sort of work with this to actually make it happen, you're going to have a much broader approach and very different approach to partnering, which is also very interesting. So I'm going to step you through each of these one by one now and share a bit more. So the first one, costly high-tech care shifting to lower cost high-tech care. What's that all about? That's basically technology enabling low-cost delivery using low-cost channels and also algorithms that sort of have some intelligence encoded in them to basically support the delivery of healthcare. It's both an emerging market and a developing market. It's both an emerging market and a developed market phenomenon. The drivers are slightly different in both markets. So in the developed market, it's really a kind of cost and convenience type equation. So for example, in the UK, there is an online doctor service, purely online doctor service, self-pay. They have an algorithm that enables one physician to see 1,000 patients in 1 hour, which you might argue is pretty crazy. But actually what they've done is they have been able to protocolize the care, the docs just basically handle the exceptions, and that's actually the extreme to which you can push the model. They usually run it a bit lower than that. But that's one example. It's a self-pay model. People use it. People use it because it's just so more convenient to get access to a physician that way and get the meds delivered to your door than it is to actually go to a physician, etc. My probably favorite emerging market example is the HMRI service in Andhra Pradesh, which is the southern state in India. They cover roughly 70 million lives at a rough cost of about $1 or less per healthcare interaction. And in emerging markets, that is practically the only way that you can get to the the so-called bottom of the pyramid part of the demographic. And I think for the let's say 2 to 3 billion people in this planet that don't really have good access to healthcare, structurally that's probably the only way that you're actually going to deliver something like that by using technology. And there are numerous other examples in other countries that you could talk about. Moving on to the second one now, data. So I would assert there is a data explosion happening in healthcare. This explosion is sometimes termed big data, right? You may have heard of big data. Big data means large data sets. It means velocity in the data, lots of dynamic changes in the data. It means very sort of diverse data as well. Those are the three things that really characterize big data. And so what's causing the data explosion in healthcare? I think the first thing is this whole explosion in genomic data. So I mentioned Moore's law, and in essence, the cost of a CPU, the cost of a megabyte of storage is halving every 18 months. The cost of a human genome sequence is probably getting 1/10 or 1/100th every year or so. So you've got Moore's law coming down like that. You've got the sequencing costs coming down like that. You've got a huge squeeze happening there. And in essence, for every $1 of sequencing equipment you buy, you have to spend $10 basically storing and analyzing this data. That's actually becoming the bottleneck. So for companies that are in the midst of that sort of really is the bleeding edge for them. The next series of data is more activity-based data, so clinical data, claims data, the costs in the healthcare system. These are becoming at scale. In many parts of Europe now, medical records are sort of 90% plus adoption. It's lower in some countries. And that enables a whole new bunch of techniques and analytics and insights to be actually gleaned from that data. And then thirdly, social media data, patient and physician-generated data is a huge additional source of insight. So we've got this data explosion going on. What are the implications of that? Frankly, if you're a drug or a device manufacturer, it's a pretty scary world because you're in a world now where, guess what? Your customers know more about your products than you do. And what are you going to do about that, firstly? Secondly, your competitors may get a steal on you and know more about your products than you and position them accordingly to your customers. So that's a big threat, but it's a huge opportunity. If you look at the frontier in medicine, personalized medicine, much talked about, but still a way to come. the ability to link large data sets of genomic data with clinical record data in terms of how you could drive personalized medicine, child recruitment, for example, that offers boundless possibilities. So again, it's a double-edged sword, benefits, but also some risks as well. I think that equally applies to providers and individual physicians. It's, frankly, as a clinician, a scary notion that you might have this transparency on what you do, and people will ask you more questions on it. You could benchmark yourself against others. Some clinicians resist that, some actually actively embrace it. And what's true is whenever you start to shine transparency onto clinical practice, you start to see an improvement in it. Right? That's been proved true. What's also true is the data is very noisy when you start, because data only gets good when you start using it. Right? So often you'll hear, don't use the data because it's noisy, it's wrong, doesn't have the case mix sorted out, blah, blah, blah. That's true, but actually when we start using the data to do something valuable, guess what? We'll improve the data quality, and we'll get more and more value out from that. So you have to start that virtuous cycle around it, rather than saying we can't do it because there are so many caveats associated with it. Moving on to the third one now. So again, what I would call, I guess, beyond the pill or beyond the device. So technology really creates the ability to wrap around products, services, to basically turn products into services and solutions. This really extends the value of a product. And so let's take, here's a very simple example, glow caps. You may well have heard of them. There are thousands of examples that I could have spoken to you today. But here's an example of a company that has created a simple wraparound medication. All it is a closed loop and some reminder systems that basically let you know, have you taken your meds, and help you remind them. And they've shown through, frankly, fairly small-scale clinical trials that there is a significant increase in adherence rates. I mean, frankly, the skeptic in me says that's not surprising on a clinical trial, because guess what? Adherence is always very high in clinical trials. But anyway, that's what they've shown. And I think there are other companies that are into adherence that can show a similar set of outputs. But of course, if you drive adherence, you can also drive much better outcomes as well. So here we see diabetes and high cholesterol, hypertension, another one where if you drive a lot of adherence in there, you actually drive a lot of benefit for the patients, also for the system as well. So again, here's just an example of how you can start to create much more value for everyone involved by stepping beyond the product. And of course, this is not new in other industries. Other industries, as we see commoditization in products, we see them moving much more into services and into solutions. So we know this will happen in healthcare as well. Now, this being, of course, an IVF conference, I wanted to also talk to you about my favorite IVF example. So here's an example from Belgium, where I guess the problem they have there is the patient has to basically come to the egg harvesting procedure, and you have to be scanned a lot and work out when the eggs are at their optimal time to be harvested. This results in a lot of trips to the hospital, a lot of toing and froing. And so what they've done here is they've said, well, why don't we have a self-scan model where we lend the patient some ultrasound, they scan it at home. We send the ultrasound so that some clinician can look at it and review it, and then work out when they have to come in, and then they can make the journey to the clinic only when they actually need to have the eggs harvested. So obviously that has benefits for the patients in terms of less or no wasted trips to the clinic. Physician benefits in terms of differentiation to the service to the patient, also potentially lower utilization of the clinic facilities, which again either is a cost saving or potentially you could reutilize that for doing something different. So that's an interesting example that I've found out about the IVF world. Now moving on to the next one, I must warn you here, we have some graphical images at some stage. So for those of you who are squeamish, you can avert your eyes in the next build. So here we're talking about an example of online sources being much more meaningful, both for physicians but also for consumers. The internet is a significant source of information. A recent stat that I heard in the US, and it's probably more now because this is about a year old, but 80% of patients, before they get their script fulfilled, they go to Google, they look at the medicine online, and then they go to the pharmacy to get the script fulfilled. Right? So there's lots of sort of, if you like, touch points that aren't even part of the healthcare system that are basically happening between patients and various information sources. Communities are very powerful, perhaps the most powerful resource both for patients and also for physicians. And here's an example of a emergency room physician. And I hope this wasn't in real time, because if you look at this post, it's sort of July the 2nd, the guy had a patient that had this type of injury. He basically put a saw through his thumb. And he basically posted online to sort of say, has anyone got any good ideas for how I can handle this? And he got this response back. This is 1 a.m. in the morning on July the 4th. So I kind of hoped that he dealt with it in the way that he would, and he didn't wait till this response came back, because I wouldn't want to be the patient waiting there for a day and a bit in the emergency room. But what I love about this one is, you basically take a plastic straw, you cut it in half, you slide that half of the straw through the wound, under the blade, you guard the blade, and then that kind of keeps the blade out of the wound, and then you pull it out, which I thought was, maybe that's accepted practice, but I thought that was a fairly vivid and example of how physicians really use this in practice to get those, if you like, tacit bits of knowledge that you would have around practice that would be probably difficult to find in any textbook. So, I said it was a powerful information source, so what? How can you get value from this? Well, there's three ways you can get value from this. I think one is mining and sentiment analysis. So we're in a world where today already Hollywood will launch a movie, and the next day they know who watched it where, what they thought about it. Right? That happens today. We are, frankly, in places already in a world where you can launch a new product and new drug, and you know which doctor prescribed it where, what they thought about it, what the patient experience was. This is possible. Funnily, the first companies to use this were hedge funds for kind of obvious reasons, so they could get a steal on what was happening, and the last companies to use it were pharmaceutical companies that probably have the most interest in using it. The next one is what I call the new KOLs. So I suppose there are a lot of KOLs here in the IVF side, but there are what I call new KOLs. So if you get down and you mine the interaction patterns in these communities, you see a new band of KOLs who are very powerful influencers in these communities. And let's say their profile doesn't seem to match us. I mean, maybe there isn't a typical KOL, but many often they're quite junior doctors, quite young. The one I was tracking was a radiation oncologist in his mid-30s. On his profile mentioned rather prominent body piercings, which again isn't usually a kind of KOL characteristic that I would expect, but he was enormously influential, commenting on a whole range of posts and a very trusted pillar of the community. And I think the final point on this, and again this could be much more relevant for you, is again it's a significant source to engage customers, to engage consumers, especially if I think about very emotive topics where you need peer-to-peer influencing. There's a great example around ADHD. J&J created a site called ADHD Mums, and there the debate is, do you do 8-hour medication or sort of longer medication, so school or outside of school? And really what you need is sort of parental peer-to-peer guidance and counseling, and creating a place for that to happen was a big value that brought to parents who are in that fairly trying circumstance. Moving on to the final trend to watch now in terms of the new partners. We are seeing lots of new types of entrant coming into the space. So high-tech, telco, consumer electronics, financial companies, retailers, CPG companies. Why is this happening? It's happening because, quite frankly, a lot of their home markets are quite tough, right? So they look at healthcare and they think, oh, high margins, let's get into there and get some of that action. Now, there's still a debate on whether they can really handle the complexity of the healthcare environment and the whole regulation, et cetera, there. But it's certainly lots of folks are piling in. And to just give you a sense around that, a few years ago, I looked at how much mobile health, joint ventures, and venture capital deals were going on. In one quarter, there's about 85 million, at least, of public recorded deals in seven VC deals. And there were roughly 41 B2B partnerships involving roughly 100 companies, only 3 of them in the traditional kind of healthcare sense. So again, that gives you a sense of how much money is pouring into this space. That's only one tiny slither of this, but also it's involving such a broad diaspora of different players, which is also a very interesting trend. Now getting on to my third question, my third overarching question: how disruptive is this actually going to be? Right. So clearly, there's a lot of smoke at the moment. I guess the debate really is how much of this is real fire. Right. So certainly from my perspective, it feels like there's a mini arms race going on here, right? We've got new players that bring new skills into the market. So some of the financial information services industries like Bloomberg and Thomson Reuters have founded their own healthcare arms. They bring some interesting analytical skills to bear at scale with very large data sets, which could be very valuable in healthcare. Again, I mentioned the point on new entrants, lots of innovative new products and services like the Bosch entry into telemedicine or the Intel GE tie-up around home healthcare, for example. And billions of dollars being poured into this space, both private money and also public money as well. What are they spending it on? They're spending it on things like medical records, comparative effectiveness research, wireless implantable devices, mobile health, and then app development. That's where all that money is going to. So, okay, how disruptive will this be, though? And frankly, it's too early to tell, right? But other industries can provide a fairly interesting sense around that. So, I mean, Apple is the obvious one, and frankly, better scholars than I will do much more justice to this as a case. But I mean, I like to think that Apple kind of cracked the kind of integration of content, a business model, and then the whole kind of usability aspect that's created a window on the consumer that they were able to own. And if you sort of put those three things together, then that's a pretty powerful disruptor. I don't see why that cannot happen in healthcare. Right? And frankly, if you look at a lot of the technology out there, it's very clunky, it's very non-usable. It's actually not easily accessible as what consumers are now expecting. Right? So I think it's an opportunity. One of the key challenges here is frankly scaling it. And again, I'm going to get very quickly onto those in a minute. But before we get there, I want to have a little bit of fun. This is where we have a bit of audience participation. So let's sort of say, imagine yourself, you've started your new, technology health sort of venture, right? And this is your first two years, again, product sales, whatever volume you have. So what do you do at the end of year 2? Anyone that wants to keep going with this venture, please stand up. Who wants to keep going with a line like that? Any takers? This isn't profits yet. This is just product volumes. Let's say the profits are probably not good. Probably negative. So is it just sort of post-lunch and sort of post-travel tiredness, or everyone would have been this venture, right? Anyone that wants to carry on with it, stand up. Or put your arm up. Okay, so a few people, that's good. Then we've got year 3. So a bit more encouragement. Anyone kind of, more people want to join in this? Or are we still the real believers here? So this is all, of course, this is the iPod sales chart, right? That just sort of shows you how much time, effort you have to get in to build a thing as big as that, right? And I guess the only point I want to make is we could have one of these very disruptive things with us already, but we just wouldn't really know about it yet because that was kind of really hiding under there. And the kind of the rational side of us, of most people, I'd recently the privilege to address about 600 medical device executives, and not a single person put their hand up when we got to the first 2 charts, right? So that also explains perhaps why we haven't seen one of these, because no one yet has kind of the faith to see it through the cycle. But that's the sort of level of preparedness you have to be to create a big disruptive thing, and so far I haven't seen it in this industry. So now let's move on to the fourth and final question I was going to address in terms of the challenges and also what it will take to win. So there's 4 real challenges that I see. I've hinted at them already. The first one I call the race to the bottom. Lots of companies develop some fairly interesting technology, but they just give it away for free. In essence, just spoiling the market. Maybe they hope that it will spawn a network effect, but it kind of becomes a new normal, and no value really gets created. It doesn't get valued by the people who actually use it. Or the other side is you just buy some technology and kind of go searching for a problem to actually address with it. That usually doesn't go too well. So that's a bit like, again, pushing on rope if you actually try and do it that way. The next one is just some of the uncertain access you have around regulatory barriers, right? And one of the things I'm working with at the moment is actually when does an algorithm become a medical device? That's an interesting, legal and also regulatory question. But some of the work I'm doing now, we're having to work out which side of the line we have to be. It's a fuzzy line, it's moving. The regulators aren't sure either what they want to do with it, and there are sort of benefits and drawbacks from being either side of it too, right? So again, that's evolving. There's a lot of complexity that you actually have to handle there. The next one, how do you actually get paid for some of this stuff, both as a physician but also as a product company as well? Typically, again, the reimbursement works around, here's a product, I throw it in, and you get paid for that product. It doesn't work around, oh yes, but I'm going to enhance the value of that product by adding another service layer onto it, and we'll kind of share some of the value from that, or you'll pay for that. Those sorts of reimbursement models don't work too well. Or let's say I'm a clinician, I do a remote consult. How do I get reimbursed? How do I get paid for remote consulting a patient? In many systems, there isn't a way that a clinician can get reimbursed if they don't physically see the patient. So that is a great detractor on any kind of tech-enabled model. And then, finally, there are different incentives across the healthcare value chain. And I think, for me, the most important thing is there's a lack of clarity around how you would drive adoption, who's going to integrate that across the pathway, and how do we share some of the benefits for actually driving this. And now in terms of, I guess, what do we think it will take to win in this? There's, again, 4 things I'd like to propose. I think one is, again, there will be a wave of rapidly identifying, bringing new tech to market. Frankly, some of these will fail, some of these will succeed, but that's a rapid escalation, if you like, of bringing things into the market and testing them and using the market to test these things. I think that's going to be with us, and you have to be sort of very much in that mindset, coming out with a first version and then the next one and the next one. The next thing will be around orchestrating the players. So how do you get the different players working together, the high-tech players, the providers, the clinicians, et cetera? How do you get that partnering happening to sort of get things to be aligned, to get the stars to be aligned across the healthcare system? People that work out how to do that will succeed in this. The third is how do you build a case for adoption? We've seen some of the evidence. We've seen some of the RCT, the random control trial evidence. Compelling, yes, but actually people want to see it much more in the real healthcare system. How does it work in the real world, not the stylized and artificial world of the trial, right? And that involves obviously embracing the transparency around healthcare data and being able to measure that, and probably doing some kind of gain sharing type of case to actually drive the adoption there. And then finally, again, throwing a point solution into the system itself, in my experience, is the less impactful way to do it. It's really driving an innovative solution that kind of changes some of the structural components, has maybe a pathway focus across the healthcare system. Those are the things that will really have the true impact. And again, those are the things that require all the 3 things above. So that is, I think I've taken about the half an hour. That is pretty much what I wanted to cover with you. And thank you very much.